Hi everyone, I am Dr. Pankaj Singh, Senior Consultant Gastropedia Noida. Today I will be discussing about constipation. Basic definition for general people, what is constipation? Constipation is basically a problem in passage of stool. For us as a doctor, we define constipation as infrequent passage of stool, that is less than 3 stools per week is defined as constipation. So there are the symptoms for constipation which patients do come to us saying that they are having constipation, like less than 3 stools per week, passes of hard lumpy stool, excess straining in passing stool, feeling of blockage at the time of passage of stool, or incomplete evacuation, or sometimes they used to have digital manual evacuation of the impacted stool in the rectum. So these are the common symptoms of constipation. There are certain alarm signs which can be there with constipation, like presence of blood in stool, excess loss of weight, excess abdominal pain, loss of appetite. These are certain alarm signs. When those are present with constipation, they suggest that this particular person or the patient needs detailed evaluation. So what are the causes for constipation? When you say constipation, constipation is basically divided as primary constipation and secondary constipation. Primary are idiopathic constipation, that means they don't have any specific cause. So primary constipations are basically functional constipation, and second category is the IBS, or what we call as irritable bowel syndrome with constipation predominance. And secondary constipation are those which do have certain causes, like the use of medications like morphine. Some patients for pain, they are on long-term morphine. Use of calcium, certain antihypertensive like calcium channel blockers, use of amitriptyline, use of calcium and iron supplements. And other than these, other metabolic causes like diabetes, thyroid disorder, neurological conditions like multiple sclerosis, Parkinson's disease, psychiatric conditions, pregnancy. These are the conditions which can be reason for constipation in few. Now coming to the diagnosis. So first of all, history taking is very crucial in diagnosing constipation. We need to have a very thorough history from the patients regarding the diet intake, the fiber they used to consume in the food, the use of medications, and other things need to be seen in history. And then coming to the physical examination, abdominal examination is very important. Apart from that, rectal examination is very important to look into the local causes for constipation. And then after these are done, we do certain specific tests like endoscopy. Specifically, we also do stool tests to rule out presence of blood in stool or occult blood in stool. After this, we do endoscopic evaluation like sigmoidoscopy, colonoscopy as and when required to look into the causes of constipation. Someone who is elderly, who is losing weight or associated alarm sign, we also do imaging like CT scan to look into some alarming causes for constipation. And then there are certain terms called refractory constipation. Refractory constipation means those patients who have not responded to laxative therapy for weeks, they are known as refractory constipation. So in those with refractory constipation, we also need to rule out other specific causes like pelvic floor dysfunction or defecative disorder. For this, we need specific tests like anatomical manometry. We also need defecogram like MR defecogram, barium defecogram to conclusively diagnose these conditions. Now coming to the last part, the treatment part. So the basic treatment of constipation, first and foremost thing is lifestyle change, which would include dietary modification like inclusion of high fiber diet, access healthy lifestyle like regular exercises, consuming adequate amount of fluid, avoiding a stressful life. These are the lifestyle changes which are required. Apart from these, we usually add on or start with fiber supplements in those with mild constipation. Those with some moderate or severe symptoms with constipation, we do start with osmotic laxatives like lactulose, which is commonly used. Apart from this, we also use polyethylene glycol. This is a form of osmotic laxative. Third category of laxative are stimulant laxatives like Sena or Bisocodil. These are used. And then we have stool softener like docusalide, but they are of very less efficacy. Now there are certain new molecules into the market which are secretory drugs like lubiprostone, which are also used in those patients who are not responding to the basic regimen. And then there are certain prokinetic like proculopride, which is also recently in the market, and we have been using this molecule. Now coming to the pelvic floor dysfunction, we need to categorize the patient is having dyssynergia or some other compressive problems in the pelvic floor, and they also may need surgical intervention as required. And there are certain exercises like biofeedback therapy, which is therapist assisted program where the patients are trained about relaxing the pelvic muscles at the time of passage of stool. And there are certain exercises like Kegel's exercise which also helps in relaxing the pelvic muscles. And in those patients who are refractory to all this sort of treatment may even need surgical intervention for constipation, like colectomy and cephalostomy as and when required. So these are the basic treatment principles which we follow for patients with constipation. Thank you.